Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department, joins us now. Good afternoon.
Good afternoon, ma'am.
Bring us up to date.
Our numbers in the county continue to rise as far as positive cases. The nice thing is we are starting to see a bump up in the vaccination numbers as well as more people learn about the Delta variant and things like that. We're starting to see some larger daily increases in our vaccination rate as well. But these numbers that we're seeing daily are about a third to half of where we were at the peak of our second wave, which was end of 2020, beginning of 21 in the holiday season. So we are still trending upward. We're still seeing more cases. We're still seeing an incredibly high demand for testing at this point.
Let's talk about testing. Where are we at capacity wise? Do we have enough?
So we have put on more testing in the county. More testing is coming online every day. The state has brought in some testing up in the Cicero area for the next couple days. But we are seeing a high demand for testing and the need for us to put on more. So we are looking at putting on more staff, putting on more hours to be able to provide that testing within the community. But it's that balancing act of ensuring that we have just enough and not too much, because we don't want idle hands either. That's not being a good fiscal agent of the residents' tax dollars.
Yeah. What about breakthrough cases? There's been a lot of talk about the breakthrough cases. What are you seeing?
Sure. So just as a brief refresher, a breakthrough case is a fully vaccinated individual that contracts COVID through whatever means that may be. And statewide, the number has been steadily growing, and it's actually been doubling quite regularly. The number last week was of all cases, of all of the fully vaccinated individuals, was about 0.225%. This week, it's about 0.416% of all fully vaccinated individuals. That's almost 13,000 people that have been vaccinated, seeing a breakthrough case. Now, that should not discourage anyone from getting vaccinated. In fact, it should do quite the opposite. While folks may contract COVID, even though they're vaccinated, the vaccine virtually prevents you from going to the hospital. That number of all the vaccinated is 0.01%, or 322 cases statewide have been hospitalized as a result of their breakthrough COVID. And there have only been 93 deaths in breakthrough cases. And we were just talking about it before we started recording that 95% of those 93 cases were in those 65 and older, and the average age is 80 years old in that group. So while it's disheartening to see those deaths and those hospitalizations, I think that's just further reinforcement that these vaccinations are doing exactly what we need them to do.
Yeah. So what does that mean for people who got vaccinated? I know it was so liberating when you finally got vaccinated to not have to wear a mask and to be able to visit with people indoors, but do we need to maybe temper that a little bit?
Well, we do recommend that folks are wearing their masks in public spaces at this point, in indoor spaces, that is. Especially when it's not people, for so long we talked about being in our cohort and staying in those cohorts. And, I think we can open those up a little bit, but we still need to consider who we're spending time with, how we're spending time with them. And, especially with our kids being back in school, the thing that we're talking about now is the kids could contract it. And I can't remember what state it was, but an unvaccinated teacher, was not Indiana, but an unvaccinated teacher had come into school, infected a large number of students who in turn took it home. So this is where, we're not advocating closing school. We're advocating everyone wearing their masks to help prevent that spread. But, it's just an instance of where that infection rate is so high, and those kids, they do what kids do, and they touch things and put their hands in their mouths, and their mouths where they shouldn't be, and things like that. That they're great little germinators and spreaders of the disease. You know, we need to be extra cautious with them and make sure that we're, you know, doing what we can to help safeguard them, because they are the ones that will bring it home to the other individuals that can't get vaccinated or refuse to get vaccinated.
How are our hospitals doing? Are we in a bad spot? Are we okay?
We're not in a bad spot, but we're not in a great spot either. We have seen a number of our hospitals max out their ICUs, max out their EDs for a while. They do manage to get them back under control. You know, part of the problem is that, you know, they are seeing an increase in patients, but they're also having a problem with staffing as well. You
Yeah.
know, these folks have been truly on the front line of the fight against COVID, whether directly associated with the COVID wards and dealing with COVID patients, or doing support roles or working elsewhere, that they're running into fatigue issues and things as well. And, you know, we've been that bend but don't break this whole time. And, you know, we need our residents to do their part to help keep our hospital network strong and going strong to serve our communities.
Well, I would imagine on top of the COVID vaccine that folks ought to be giving some thought to the flu shot as well, because that season's quickly approaching.
That's right. You know, September, October are really the time we start advocating folks go out and get their flu shot. The other thing we're looking at is third shots for immunocompromised individuals. They are, if you're immunocompromised, and there is a list of specific groups that the state is targeting on their website, which is coronavirus.in.gov, that you can go and look to see if you fall into that category. They are advocating that you get a booster shot, or I'm sorry, a third shot. And they're also saying that whether you got Pfizer or Moderna, either vaccine is sufficient for your third dose.
Okay.
So if, you know, if Tammy got Pfizer before and needs to get a third dose, she can get Moderna or Pfizer. Get in and get your shot.
And you
We
can do the COVID vaccine along with the flu vaccine, correct?
that is correct. So it is a good time to go ahead and knock both out. There is no contraindication. No, it seems that there's no greater risk than we've already seen by getting both vaccines done at the same time. So, you know, we would highly encourage everyone to start thinking about the flu vaccine as well.
Sounds good. Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department. We'll check back in with you again next week.
Thank you, ma'am.